Should we be using probiotics to prevent deaths from the swine flu rather than the flu shot?
What a concept that is. Now, nobody's come out with that idea. But what happens, as it turns out, is that most people, most kids, who die from the swine flu are dying from what? MRSA infections.
And MRSA means methicillin-resistant Staphylococcus aureus
Right.
infections. In other words, people that have infections that can't be cured by an antibiotic because it's developed a resistance to the antibiotic.
Okay, so these are people who are carrying the methicillin-resistant Staph aureus, okay, in their respiratory passages. And when they get sick with the swine flu, there's a synergy that occurs that allows many of them to develop infections that are MRSA infections that are lethal. In fact, if you have a MRSA infection, the death rate, if you're in the ICU, is about 8 times if you don't have a MRSA infection.
And if you have it with the flu, I guess that lowers your resistance to...
Well, there's a synergy there where they seem to really attack lung tissue big time. So what would happen if we now have a lot of people in the community who are carriers of MRSA, which is the case? A lot of people who have MRSA. What would happen if we gave them probiotics that they could use in their mouth and their nasal passages so it would crowd out the MRSA infection? Doesn't that make sense?
See, the probiotics are the friendly bacteria, and so we need those, and like you said, to kind of crowd out the bad stuff.
Well, get them to grow. I mean, why would you want to be carrying around MRSA or any other microbe that if it gets into a certain amount of volume of bacteria, it makes toxins that make you sick? You wouldn't want that.
You know, a year or so ago, the headlines were saying that healthy children were dying from the H1N1 swine flu, and that they were trying to promote more vaccinations because of it. But vaccinations can have a downside. There are a lot of additives and things in those shots that aren't so healthy.
You really are making an assumption when you say that the swine flu or other influenza vaccines are saving lives over how many deaths are causing or complications, because the unfortunate truth is that the CDC is a big liar. They basically withhold information, and if you want really good information about what happened back in 2009, go to drsaputo.com, have a listen to the Infection Deception Part 1, and there you'll have about a 10-page story that reviews what happened and talks about the deceitfulness, that they're hiding things, that they're making proclamations based on their whims, and then coming out saying that you need to do certain things like take the flu shot, get your Tamiflu, and really what they're doing is they're promoting a lot of product for reasons that are probably conflicts of interest that we don't know about.
And you know, the way they write up a lot of this is very difficult to understand. It's kind of tricky the way they do the percentages and everything, you know. Like they did this study and they showed like 70% of the children that died had other health conditions.
And underlying health issues that were serious. And that's why there's so many kids that are dying from it. When you
Plus
look
they had the MRSA too, right?
Some of them did, some of them didn't. I mean, you can die from H1N1, okay, the swine flu by itself. You can. And there are certainly deaths from that. But nowhere near the number of deaths that you'll see with those that are complicated by the MRSA infections.
Okay, so out of the 100%, so 70%
have an underlying disease. Their immunity is not very good. They're probably not going to respond to the flu shot anyway, and they're the ones that need it the most because they don't have a great immune system. And that leaves a few people, maybe 30 out of 100, who might respond to the flu shot if they were given it with no guarantee that it will take. So now you're talking about maybe 5 people out of 100 that have been helped, that would go to the ICU and have these big infections. That's not so many. That's only a few hundred in the whole country for the year.
Well, out of all the kids that were in this study, 9% died.
That were in the ICU.
Yeah, that were in the ICU.
That had all these complicated factors, because most of them were people that had complicating illnesses that died. So we have to be careful about assuming that taking our flu shot is a good idea. It really annoys me when I see a direct-to-consumer ad, or I call Walgreens or Walmart because I'm calling in a prescription, and the first thing I hear is, we're giving flu shots, you can come and get them. And it's like they're just making the assumption that these are good things to do. And I have to tell you, it's one of the last things that I would recommend. I do not recommend them for my patients, and I don't recommend them for my family. I don't think that we have data to show us that they really work. I can't wait for a simple study to be funded by the National Institutes of Health that looks at one community, okay, neighboring communities, 2 communities, one where they're giving the flu shot and one where they're not. And then looking to see how many people got the flu, how many people died from it, how many people had serious complications, and how many people had problems with the vaccine.
Well, the other thing is you need to realize that the big problem is the combination of the MRSA with the H1N1 flu.
Well,
that's what the problem is, and that's why we're suggesting that it might be a good idea to try taking probiotics. They're not going to hurt you anyway.
Well, instead of getting your flu shot, take your probiotics in the wintertime, but make sure you're taking a probiotic that's a nasal probiotic. It's not just the one you take by mouth. And I'm not sure you
nasal probiotic?
You'd have to squirt something in your nose and mouth.
Do they have such a thing?
No, we have to make such a thing. So what I'm proposing is a much simpler thing. I mean, a probiotic doesn't hurt anybody, but a flu shot does. And so if you can accomplish the same thing by getting rid of that MRSA, you'll get rid of 2/3 of the deaths, more than that, 3/4 of the deaths.
Sniffing probiotics like cocaine or something.
Well, you don't have
Make
to.
a line of probiotics.
Well, there you
Take
go.
your capsule and open it up, and there you go.
Well, that's a nice way to look at it. So, as we're looking at this whole business of flu deaths, particularly in kids, the flu shot is one way that might be of value, but it is clearly unproven. As is this idea that I have of probiotics that are nasal probiotics to try and crowd out those infections that are MRSA infections that are ones that lead to all the problems in the ICU that